My name is Saad Tarabichi, and I'm an orthopedic surgery resident at the Mayo Clinic in Arizona. And I'm very excited today to be talking to you about our article that was published in the recent edition of the Journal of Bone and Joint Surgery entitled Isolation of Multiple Positive Cultures at Resection Arthroplasty is a Predictor of Failure Following Reimplantation. So it really sort of inspired an interest in doing this work after we saw that there was some literature out there on patients with bacterial sepsis showing that the number of positive blood cultures in patients with the diagnosis of bacterial sepsis is actually very predictive of poor outcomes. Has been shown to predict not only 90-day mortality, but also 90-day readmission rates and 90-day return to the ICU rates. And so, in the setting of PJI, in patients undergoing two-stage exchange arthroplasty, there's now substantial evidence to show that the type of infecting organism can be associated with treatment outcomes. However, there are very few published studies to date on whether there are other microbial factors that may be associated also with treatment failure. And so we performed a multi-center study enrolling over 500 patients with a diagnosis of PJI using the 2013 MSIS criteria that were undergoing two-stage exchange arthroplasty. A standardized approach for two-stage exchange arthroplasty was used in all patients that were included. And getting right into the findings, very interestingly enough, we found that if patients had two or more positive cultures at resection arthroplasty, they had a 96% rate of treatment failure compared to only 70% in patients with a single positive culture. When we performed multivariate regression analyses to control for covariates, such as patient comorbid health conditions, the type of infecting organism, and interstage duration, we found that the isolation of two or more positive cultures was associated with a more than 8 times increase in the odds of treatment failure being a revision for periprosthetic joint infection or PGI-related mortality at any time point. So we actually believe that these findings have significant clinical implications. In cases where the microorganism has been isolated preoperatively using joint aspiration, physicians may not place a huge emphasis on obtaining multiple high-quality intraoperative samples. Based on our findings, we believe it is paramount, even in cases where the bug is isolated preoperatively, to ensure very thorough debridement and ensure that you obtain multiple high-quality tissue specimens, as this in our study has been shown to be a prognostic indicator. So it's going to help us not only counsel patients on their risk of treatment failure after two-stage exchange arthroplasty, but also may warrant the use of preventative strategies such as extended oral antibiotics. Thank you very much, and we hope you enjoy reading our research.